Good morning and welcome to the Senior Hour, which is sponsored by Comfort Keepers in Home Care, Santa Clarita Hearing Center, and Traditions Healthcare. I'm Barbara Cochran with my co-host,
Dr. Jean Dorio,
on your hometown station 98.1 FM, AM 1220 KHTS. This is a show for, about, and by seniors, giving information to enhance one's quality of life. And speaking of quality of life, our guest this morning is Dr. Kalani, a palliative care doctor. Good morning. How are you?
Oh, good morning. Thanks for having me.
Good morning, Mala.
It's nice to talk to you.
It's great to talk with you, and congratulations on a great article in the Los Angeles Times front page, your picture even, for the things that you do at Holy Cross and the community here in Santa Clarita as well as in the San Fernando Valley. I thank you very much for your service. The job you are doing and your colleagues are doing has been tremendous and not easy. It has, with this surge, it has not been easy. And I think for this hour, we can go over some of the difficult decision-making that you have to make. So for our listeners, for those who don't know exactly what you do at Holy Cross as a palliative care doctor, can you just let them know what you do, what your job is, and what some of those decisions that you have to make with patients who are at your facility?
Yeah, sure thing. So as a palliative care physician, I get the pleasure of being able to see patients who have pretty serious illnesses. And it could be either acute serious conditions such as a bad trauma, a brand new stroke, devastating brain injury, or it could be conditions that are expected to have some serious concerns, serious outcomes, such as advanced cancers, dementia, Parkinson's, and such. And typically within the hospital setting, the palliative care team, and the team really it's a team, so it's comprised of physicians, nurses, I have a nurse practitioner, social workers, and chaplains. Our team gets together, makes assessments of each individual patient who is slotted to be evaluated by palliative care, and we try to figure out what enhances their life. What is quality for them? How can we help with their symptoms? How can we provide them support? And also we talk about advanced care planning. So so there's a lot of things that we attend to within the hospital setting. More specifically, lately, we've been having to see the surge of COVID-19 patients. And actually, this started back in late March. So our census for COVID patients has remained quite high here at Holy Cross since March. So it's not been... we've had very high numbers ever since this outbreak occurred for us in Southern California. And unfortunately, we remained high even up to the 20s at the lowest points where other hospitals were having just a trickle of patients. So we've been consistently seeing COVID-19 serious illness patients throughout this entire pandemic. More recently...
Go ahead.
No, go ahead.
Well, with COVID patients are older adults. What I want to make sure is that you and I and Barbara discuss a discussion that should always take place before you get sick, before you are hospitalized. And, right now, the worst thing that could happen, I believe, is when someone gets ill and the family, the the person who then makes decisions, who has power of attorney, doesn't exactly know what the wishes are of their loved one.
Yeah,
And that
it is such a
discussion needs to
challenge.
take place. Yes.
Oh, it's terrible. It's absolutely terrible. And I'm confronted with that discussion every single day.
Wow.
And it's awful. It's awful that we're not having these conversations. It's awful that our seniors are not sharing what's important to them with their loved ones. We need to do it because at the rate that we're going, they're saying that in LA County, 1 in 3 are being exposed to COVID, and that's a high number. 30% of our population in LA County being exposed to COVID-19 puts a lot of people at risk for some very serious situations.
Exactly. So there is legal paperwork that, when we have a discussion with our loved ones, there is legal paperwork. And sometimes even the legal paperwork is not clear.
Right.
And with this discussion, clarity can come, but you have to talk to your loved ones. And, I think sometimes, we have power of attorney, we have DNRs, we have advance directives, we have pulse of physician orders, that say certain things go on, but there's blurring of the lines, isn't there, sometimes with what, the family might say, oh, my loved one wants to live and see their grandkids graduate from college, or, they don't want to live as a vegetable, and things like that always. And, as doctors, we can't predict, always how they're going to react to illness. So what are the things legally that you like to see in the paperwork, the legal paperwork, that might be helpful to our listeners?
I think within the legal paperwork, it's important to define what a quality of life, or what would be meaningful existence for each individual patient. What is a meaningful existence? Listen, if a patient is happy sitting in a bed being taken care of 24/7 by staff, but they're happy because they're sitting in bed and getting to watch TV every day, then we just need to know that. But if that's not a meaningful existence, we need to also know what is meaningful. Is meaningful being able to care for themselves, being able to eat, being able to communicate. Those are the things that actually are much more important than just a vegetative state.
Absolutely. I know with my patients, many of them say they want to be with their family. They want to see people grow, their loved ones grow.
Exactly.
That connection with not just their friends but family members makes a huge difference. But if that discussion doesn't take place, Mawa, how does someone with power of attorney know the direction when it comes time to make decisions? It is not easy.
No, it's not. And so basically the conversations that we're having is, okay, so the path that your loved one is going down at this point, this is what we're expecting. And the question back to the family is this a path that your loved one, that, your mom or your dad would want to live? And they have to share back as to whether they think their mom or dad would. And it's variable. Everyone says different things. The thing is that there are some people. I don't mean to be offensive in any way, but some people just don't know their parents well enough.
Absolutely.
And
You're
they
right.
don't. I think that these our seniors are more connected with their church families or their community center families, or their neighbors more so than their own children or other loved ones. And we're relying on people who don't know their elderly parents very well. And
Right.
so
But
if we're
you can learn, right, if you have that discussion. But
exactly.
how does one, so Mama, how does one, as a, not just just as the child of older adults, parents, how does one broach that discussion without saying, hey, you know, Grandma, you're going to pass away, soon. What do you want us to do? I mean, that's pretty abrupt. Um, but we need to open it up so that family members know. And, you can, how do you bring that up in a situation, not in an ICU or in a hospital, but at home with your loved ones? It's not an easy task.
No, it's not. And I would say that at the point that we're at, and because this is the senior hour and this is the hour dedicated to our seniors of our community, that it is imperative that each one of your listeners reviews their wishes, thinks about themselves as to what would they want in case of such a serious outcome, that they need to communicate it to the person that knows them the best. If that's
right.
a son and daughter, great. If that's a nephew or niece, wonderful. If it's a neighbor, that's wonderful too.
But that discussion needs to take place now, while when one is healthy, when one is of sound mind, and where questions can be asked. And I do think by making sure that even though not necessarily 65 or older on Medicare, starting to have health problems, you should bring the discussion up. 40 years old, 50 years old, you don't know. We don't know what's around the corner. So it's a worthy discussion to maybe utilize the legal paperwork to say, okay, this legal paperwork says this. What do you think about that? So this is not easy, but because of this virus, because of the older population is affected more than others, the discussion needs to take place, because we are getting to crunch time right now with ICU beds. And, I've written before in the past, as you guys and our listeners know, if you have gray hair, you got one count against you. Now, I heard our commissioner on aging speak yesterday, and they said age is not a factor. But I will tell you, when push comes to shove, it could be in the background a factor. It's not supposed to be, but it could be. And if you have certain wishes that you want your family to know about, the time is now to discuss that.
Right. And I hate to have to see, and I've seen it time and time again, where families simply do not know their loved one well enough. They decide to do some pretty life-extending measures, and then that patient wakes up and is absolutely devastated at the outcome. And I would hate for any of your listeners or anyone in this community to have to undergo that amount of suffering. And I'm not even talking about physical suffering. I'm talking about deep emotional, existential suffering.
Right.
So it is so important to make those decisions in advance.
Right.
Yeah.
So what were you going to say, Dr. Dorio?
No, it's such a pertinent discussion, because as older adults, we are under threat with this virus, and it just makes it easier if we know at some point what your wishes are. And I have the whole gamut. Most of my patients, no matter what age they are, they will say, "I want to live." I want quality of life, certainly. And many will tell me that they don't want to be a vegetable, right? They don't want to be stuck on intubated. And, in my 40 years of practice, I have not had I have not had to face these problems because this discussion has taken place, and every primary care doctor, every gerontologist, any physician, nurse practitioner, physician assistant, they know to have this discussion with the older seniors out there. So it's an important part of what this show needs to have and tell the younger generation, have the discussion. Don't be afraid to have it.
Yeah.
That's very true. And we need to take a break, and we'll be back in a few moments. I'm Barbara Cochran with my co-host, Dr. Jean Dorio, on your hometown station, 98.1 AM FM 1220 KHTS.
When you look at your child, you see so much. A creative spirit that surprises you every day. A little leader growing to discover who they are, what they love, and how they can make the world better. At SCVI, we see those same amazing things. Our tuition-free TK through 12 charter school provides boundless opportunities to think critically and imagine freely, with a learning program customized just for your child. Today, that means empowering your child to bring strengths and passions to the distance learning environment. Our approach keeps your child and family in step while online, inspiring your learner to keep growing without missing a beat. At SCVI, your child will find even more ways to grow with projects and activities in STEAM, robotics, theater, music, and sports. With the only international baccalaureate program in Santa Clarita, SCVI produces graduates who excel at top universities and in life. For enrollment information or to learn more about our distance learning program, visit ileadsantaclarita.org. iLead Schools. Free to think, inspired to lead.
Congratulations to Dave Reeves and his team at Reeves Complete Auto Center. They just celebrated their 11th year of serving the Santa Clarita Valley.
Thank you so much for choosing Reeves Complete Auto Center. I know you have plenty of choices for your car repair needs, so we appreciate you picking Reeves.
Tune-ups, brakes, transmissions, 30, 60, and 90,000-mile services, and much more. Find out about their special lifetime oil change program. Reeves Complete Auto Center on Ruther in Canyon Country. Find them online at reevesservice.com.
Please remember to support the Boys and Girls Clubs of Santa Clarita and the SCV Rotary Club.
Aloha, friends. Go check out Honu Coffee, home of the best cold brew coffee. What makes their coffee special is how their organic coffee beans are infused with nitrogen to create a smooth and delicious cup of coffee. You'll also find traditional bold coffees and island-inspired signature drinks. They're the perfect place to catch up with friends or just relax with your favorite cup of joe. Honu Coffee on Lyons and Walnut in Newhall. Stop by and say aloha.
And now for your convenience, a second Honu location at 23502 Lyons Avenue between Peachland and Apple.
Santa Clarita Valley residents now have greater access to the excellent physicians and high-quality medical services for which Providence Holy Cross is known. Providence Holy Cross Health Center in Santa Clarita features state-of-the-art cancer and imaging technologies, as well as board-certified physicians in a variety of medical specialties. Quality and compassion from a healthcare provider you can depend on. For more information, call 1-888-HEALING or visit us at providence.org.
La Esmeralda is home to truly authentic Mexican food. This family-owned restaurant prides itself on its fresh-to-order menu. Even the tortillas are made in-house. If you have a taste for sizzling fajitas, flautas, or menudo, you have to try La Esmeralda's Mexican and Seafood Restaurant. Dine in or order out for the most authentic Mexican food Santa Clarita has to offer. Their Taco Tuesdays, it'll turn you into a regular. La Esmeralda on Bouquet at Haskell.
Consumers Furniture is back open for your business. The safety of our community and our staff, above all, is most important to us. We will provide a safe and clean environment for you to find the perfect piece of furniture for your home. To help you with your purchase, we are offering 25% off your entire order or 24 months same as cash financing. And for our awesome essential workers, we will deliver locally your furniture free of charge. Consumers Furniture is located in the Center Point Shopping Center below Sam's Club and Walmart.
Your hometown station.
Will you still need me? Will you still feed me when I'm 64?
Welcome back to the Senior Hour. I'm Barbara Cochran with my co-host, Dr. Jean Dorio, on your hometown station, 98.1 FM, AM 1220, KHTS. And we're speaking with Dr. Mawa Kalani, a palliative care doctor. And my goodness, we have really, really covered some area today so far, haven't we?
Yes.
Well,
Yes,
because
we sure
it's kind of, isn't it nerve-wracking, though? I mean, when you read the LA Times article, you know, the sympathies are out there, not just for family members, but for you and your staff, Mawa, that have to face everyday decision-making, not easy decision-making, life and death decision-making. That is not easy.
No.
And it preys on you.
Yeah.
It just does, unfortunately. I mean, how do you handle this emotionally?
I think for myself, I mean, I can't speak on behalf of my team, although my team is just amazing. They've got amazing amounts of resilience and spirituality and just a deep calling for this type of work. But I think for myself, you know, I value my family. I value the time that I spend with my husband and my kids. And my parents, and I think that gives me, you know, deep appreciation for life after doing the work that we're doing here, and I think that that's probably how the rest of our team feels too. I mean, we're having these hard discussions easily anywhere between. I mean, I'll be honest with you, Jean. I have 60 patients on my list.
Wow.
And typically, for a regular palliative care census is about 20. So we have, you know, triple the amount of conversations that we usually do. And it's very challenging times, and I think we all go home very, you know, emotionally drained, emotionally exhausted, and we do the best we can. But I love spending time outdoors. I have 2 golden doodles that really bring a lot of love. And so those are the things that, you know, help to balance me out and fill my bucket, if you will, with good energy. So,
well, your group at the hospital, Dr. Kalani, do you get together as a group on a specific day or time and just generally discuss and get feelings out of not only of your patients but of your team members mainly?
Yes, absolutely. We actually meet daily, every day at 10:30, and we not only review all the patients, but we have good time together. And if that means like a venting session, then it's a venting session. If it's time to have a cup of tea or enjoy a piece of pie or some candy, we'll do that too. So we are very dedicated to our self-care, and we do not let that get pushed aside. It's extremely important for the type of work that we're doing in healthcare.
Oh, absolutely it is. Absolutely.
If you have 60 patients, how many of those are what we were just talking about, where patients and families where you really have no understanding or even legal documentation of what the wishes are of the patient? Of 60, would you say 5 or would you say 50? I mean, are there just a lot of people that don't have this discussion?
Oh, absolutely. I would probably say, and I'm just kind of scrolling through my list, probably closer to 40 to 50 of those patients.
Really?
Have not had any meaningful conversations and did not have meaningful conversations. And that includes patients who are well into their 90s.
Wow.
We never talked about it. How is that possible? Is there no discussion about, if, this is what I would want to leave as a part of my will or as a part of my legacy? um, these discussions have to be had.
Mm-hmm. And obviously
Typically,
they're not then.
no, they're not. They're not. So that's what's so difficult with these
Mm-hmm.
cases is, I have patients who are retired physicians even not having discussions, or patients who are lawyers who are not having discussions. And it is unbelievable. It's truly unbelievable.
So we ask
Um,
the question, why? Why is it that people will not touch on what they want, possibly at end of life? I mean,
I
why?
think people
And
are
there is
afraid.
that fear. Yeah,
I think
there's
they're
that
simply
fear. But
afraid.
but let me put it a different way then.
Yeah.
Let me put it a different way. How would you like it as a individual or as a caregiver? How would you like someone else making that decision for you because you haven't had that discussion? Because that could happen
Oh,
where we don't know, and someone else is making that decision. Uh, isn't that kind of shameful, or sad, or threatening, or even more fearful? How do we allow somebody else to make that decision?
and that's the question I ask myself every day. I'm trying really hard to, make those conversations simple, but these are
Mm-hmm.
very complicated situations.
Yeah, well, they
Yeah.
are because you have so many emotions involved.
Mm-hmm.
Absolutely.
I mean, if a family member finds out that his or her mother wanted to do this, that, and the other, and he says, "What?"
Yeah.
And then all kinds of what breaks out
Oh,
Right.
in
There's
more ways
battles
than
and
one.
fights and discontent. You're
That's
right.
right, especially if there's more than one person involved in that family situation,
yeah.
children.
Yep.
Oh, yeah. Yeah,
See
there's
it all the time.
always contention. Yes. Yes.
Yeah.
And
Um,
that's why it's so important to share your wishes with your
and,
family members, your neighbors, or whoever is close to you. Let them know what you want them to do.
yep.
And
And
it was
Right.
interesting because Russ always knew what he wanted and what he didn't, and he let me
yes.
know that. And I made sure that that part of him was taken care of, that he would not have to worry, you know?
Yeah.
Mm-hmm.
Like I said, it's so funny as we're having this discussion. I just got a text from one of our intensivists. He asked about a 90-year-old patient. Do we know what the code status is? Do we know what are we going to do if, God forbid, this patient declines in his status? What are we
Ooh,
going to
Mm-hmm.
do?
ooh,
And this again was a patient who had not shared his wishes, and his family had absolutely no clue what to do. So I sent them educational videos. I gave them information about what each scenario looks like. But this is somebody who is 90 years old, who has COVID and is declining in his breathing status.
Mm-hmm.
So he's, you know, um, I'm really hurting for him, and he is a lovely
Mm-hmm.
gentleman. But right now, he can't really make those decisions.
Well,
Yeah.
another thing too, as you're speaking, I'm assuming he's in the hospital, is he?
Yes,
Yes.
yes,
Oh yeah.
And the other sad part about that is he cannot have any people come in to see him.
yeah, exactly.
Yeah.
No close,
Visitation. No
no,
visitation.
and that is so sad. Not only for the actual patient, but for all the people who are close to him, relative wise or friend wise. They cannot go in to
Nope.
say goodbye to him if that's what's going to happen. And that is,
Imagine that.
I cannot imagine having to go
Oh,
through that. I absolutely cannot.
it's it is torture, and it is become to the it's breaking our staff here. to have to be that extended family and then watch that patient pass away.
Right. But if you have a patient that has already said, listen, I'm 90 years old, I still drive, I'm still involved at the senior center, I still love visiting my grandkids, I have quality of life and I want them to see them get married and graduate from college and do all the things that I was hoping to see in my great-grandkids. And if you know that, then you know where your efforts have to go. It's
Absolutely.
easy if that patient has said, this is what I want. But if you have a patient that says, listen, I've lived a great life, I'm 90 years old, I've had great quality, but I also know that, I have a threatening virus, but I have to recognize that. And at that point can say, I don't want to be on a ventilator. I don't want to have tube feedings. I don't want that. And if they can definitely say that, that helps us figure out the direction to take them. When we don't know that answer, then it gets more difficult because we have to become the decision makers. We have to be the ones that lose sleep over a decision we have made because others have not had a discussion or made these decisions beforehand. It has to be done now, and we have to emphasize that with our listening audience.
And that has to be in writing.
Well, legally,
Legally, as a piece of paper, but you know what? Just have the verbal conversation. The doctor can translate that very easily into what would be medically appropriate. Yeah. We just need a verbal conversation. And remember, that legal document does not need it doesn't need a lawyer. It doesn't need a notary. All you need is to download a free form, and Providence has free forms on the website. The state of California has free forms on the website. And all you need is 2 witnesses. You can get 2 neighbors to come and sign off. That's all you need. It is absolutely free.
Wow. But that discussion takes place and decisions are made beforehand, which is what we want. We just don't want others making decisions for ourselves. We're America. We don't do that. And, we have the ability and the right to be able to make our own decisions. So that's why we're telling our listening audience, please, seniors, please, the caregivers, the children, please talk to your family members, talk to your loved ones, bring the conversation up. What the biggest fear right now, the biggest fear I know in my seniors, because I talk to them and they know their biggest fear is that they're going to go to the emergency room, and because they have gray hair and they don't have enough beds, they're afraid of that word rationing, that they're in a crisis mode of decision-making and that rationing could take place. Whether that ever happens in this country, and it did in others, I think in Italy, it did happen with, I don't know, I have relatives in Italy, but they're not doctors. But I know friends who talk with my friends back east, talk with the Italian doctors, and they have PTSD because of their decision-making. And the same with China, too. It became rationing of care, and that's one of the greatest fears. But if doctors know what you want, and you don't have to be always specific because you don't know the situation, but if doctors know what you want, we can, as doctors, have a better ability to guide a person in their life, in the direction and the treatment we're going to give them.
Absolutely. I mean, that's I think our biggest fear is having to ration or deliberate on an ethical level who's going to get this ventilator or who isn't.
All right.
That's not. Please don't let us have to get to that point. I beg our community.
There are laws out there in terms of the crisis decision making, and so it's not that we're just thinking of these things right now. We have thought about this for decades now, so we know that it's out there, and we know that difficult decisions have to come. But we want to be able to make sure the public understands what hospitals are doing as well. And there is an ethics committee at every hospital. That's the law.
Yes.
And so ethics committee everywhere right now, supposedly in the past 2 years, have been asked to re-examine ethics surrounding crisis decision-making. And so I don't know what it is that Holy Cross or Henry Mayo, what the ethics committee has done. I chaired the ethics committee at Henry Mayo for a while. So I know there is a duty on our part to delineate exactly what, if we come to crisis decision-making, how that will be made. And of course, it cannot be related to age. Age is not a factor in this. Race, gender, background, education level, all of that cannot be considered. And so what is the biggest consideration? The decisions on the part of the patient. But if we have no decisions on the part of the patient, then we are in trouble in terms of guiding them in that treatment plan.
Yep, absolutely. And if there are no decisions, then also the decisions will be then further discussed on that ethical level as to what is the appropriate thing to do.
Well, wouldn't the family members have a say in that somehow?
Sure. When they come to ethics committee, they do. You can ask at your hospital if people are making decisions and you don't agree with them, you can ask to confer with the ethics committee, and you can, I can't, it wasn't a lot, but nowadays it's probably many more people are not sure, and you can ask to talk with the ethics committee at your hospital. So don't feel that you're kind of boxed in. You have rights and your loved ones have rights. So don't think that this is, the ultimate, it's coming down from the highest, from GOD, because, other decisions can be made below that. So we have to honor that with what families know, what their loved ones and what they might say. I can't tell you how many patients' families would come in and say, no, this is what my loved one wanted, and would correct the doctors and everybody else on the direction that we were taking that patient.
Well, we need to take a break. And I hate to stop this interesting conversation because it kind of loses your train of thought, I'm Barbara Cochran with my co-host, Dr. Jean Dorio, on your hometown station, 98.1 FM, AM 1220 KHTS.
Healthcare can be difficult if you're underinsured or have Medi-Cal. Samuel Dixon Family Health Center can help. Services are available on a sliding fee schedule. The mission of the Samuel Dixon Family Health Center is to give the Santa Clarita Valley access to affordable, quality primary care. There are 3 locations to serve you: Canyon Country, Newhall, and Valverde. Go to sdfhc.org for more information and to find the location most convenient for you.
Hello, I'm Mike Lindell, inventor of MyPillow. For a limited time, you can get a queen-size premium MyPillow for the lowest price ever. Regularly $69.98, now only $29.98. MyPillow is patented and adjusts to any sleep position. It's washable and dryable, comes with a 10-year warranty, and 100% made in the USA. I'm also giving you deep discounts on all my MyPillow products, including my bed sheets, mattress toppers, and bath towels. That's $29.98 for a queen-size premium MyPillow, and deep discounts on all my MyPillow products. Not only are you getting the lowest prices ever, but they're going to make the best Christmas gifts ever. Buy now, and I'll extend my 60-day money-back guarantee to March 1st, 2021.
Go to MyPillow.com and use the promo code KHTS or call 800-973-3927 and use the promo code KHTS. That's 800-973-3927 or go to MyPillow.com and use the promo code KHTS.
If your mortgage is $765,000 or more, You've probably been frustrated by all the advertising with extremely low mortgage rates. Because when you called your bank or one of those companies doing the advertising, hoping to refi at a low 30-year fixed rate, you found out those low rates were not available to you because you have a jumbo mortgage that exceeds their conforming limit. Well, Owning has great news. Now you have the opportunity to refinance and save money like everyone else. Today, Owning is offering refis up to $2 million at a 30-year fixed 2.75% rate and APR with no closing costs. No points, escrow costs, title fees, nothing. So call 8555-OWNING or go to owning.com.
Owning Corporation, equal housing lender. Rate assumes tax and insurance in pounds. Licensed by the Department of Financial Protection and Innovation under the California Residential Mortgage Lending Act. NMLS 1797976. Call 833-852-6464 for terms and conditions.
Jumbo 30-year fixed money at 2.75% rate and APR with no closing costs.
Do you change your own motor oil? Did you know used oil is actually hazardous waste and can't be disposed of in the trash like regular old garbage? Fortunately, Santa Clarita has over 20 certified collection centers to properly dispose of used motor oil and filters for free. When you do the right thing, you help keep our city clean. Visit greensantaclarita.com for locations near you. That's greensantaclarita.com. This message is funded by Cal Recycle.
Wishes for the new year might sound a little different. They might include eating indoors at a restaurant, cutting down on Zoom time, or just being able to hug a loved one in person. But there's one wish you can count on. College of the Canyons is ready to help you start, continue, or finish your education goals. Our convenient 5-week session starts January 4th, and registration is going on now for great classes that will move you forward. Visit canyons.edu/schedule now.
It's like no other station I've ever listened to. It's great.
Your hometown station.
Will you still need me? Will you still feed me when I'm 64?
Welcome back to the Senior Hour. I'm Barbara Cochran with my co-host, Dr. Jean Dorio, on your hometown station, 98.1 FM, AM 1220 KHTS. And we're speaking with Dr. Marwa Kalani, who's a palliative care doctor. And Dr. Kalani, is there anything, since we have a few more minutes, that we really need to talk about that hasn't been touched on in this particular time?
Yeah, please follow the directions of our officials in regards to gatherings and such. I'm still seeing a lot of people gathering with their loved ones because of the holiday season, and I get it. This is what we usually do, but this time is still very, very challenging and very unique. And let's try to brace ourselves for this winter. And please try to avoid doing any major celebrations. I'm so sorry to have to say that.
I know.
And
by all means, take care of yourself.
Yes, please.
Stay away from large crowds. Wear a mask.
Absolutely.
Be very cognizant of where you are and who's around you, especially if you have to go to a grocery store or someplace like that, you're running out of this, that, and the other, and you have no choice. You have to go. But stay your distance, please. I think it's critically important, especially for seniors, especially. And interestingly, I didn't get to go back east for Christmas to celebrate with my kids and grandkids because I was advised, don't do it. You have a compromised immune system. You are 84 years old, and you don't need anything like that. You really don't. And I was advised by quite a few people, and not to do it. And it's been one of the loneliest. Last year wasn't as bad because all the kids and everybody were home. But this year has been I've been extremely lonely this time. I really have, even though my son has been down and my daughter came down before she went back east, and a couple of my grandkids have visited, but not for any length of time or not many at a time. And it's been a rough one for me this year. It really has.
So
But
Sorry.
we have the light at the end of the tunnel. I think that the vaccine definitely will help. And, the vaccine was developed. I mean, people say that it was like over 9 or 10 months, whatever it was. But in reality, I know I know researchers at NIH, and they for years around the world they've talked about vaccines. They just exponentially moved it forward. The 10 years of research that they've done and put it out to the public. And I think when we look back in a year or 5 years or 10 years, we're going to look back at the science and say, wow, look what they did. Because this in the ability to take charge and control of this terrible pandemic has now been helped and aided by science. And, just as we end our show, I just want our listeners to know Dr. Kalani, palliative care doctor at Holy Cross Hospital, and all of those doctors and palliative care individuals who are caring for patients around the country and around the world. It is not an easy task. So we want the public to know that you have to sacrifice. You have to help. You have to help doctors and scientists move forward into the next stage, into 2021. And Dr. Kalani, thank you so much to your team at Holy Cross for doing what you're doing. You're an inspiration. The doctors at Henry Mayo are an inspiration. They have all done tremendously, but we don't want them to suffer, and we don't want family members to suffer either. So kudos to you, Dr. Kalani. Thank you,
so
Mawa,
much.
for doing what you're doing, and thank you to your team. And we want to, Barbara and I want to, and KHTS Radio want to wish everybody a happy New Year. 2021 will be that light at the end of the tunnel that we will be able to shine on and look at and say, hey, this was worthy to get through 2020.
Yeah, and we'll bring that light at the end. We'll bring it up front.
Yes.
Very good.
So that everybody can see it. Because sometimes the
That's
light
right.
at the end of the tunnel is a little bit hard to see for some people. It really is.
Happy New Year, everybody.
Yes.
From
Happy New
KHTS
Year.
And all of us
Happy
here on
New
the,
Year.
the Senior Hour. We are sponsored by Comfort Keepers In-Home Care, Santa Clarita Hearing Center, Traditions Home and Hospice Care. Listen to us next week on the Senior Hour. Now go and enhance your quality of life. Happy New Year.